Okay, hello. So we are here to talk about, God forbid, an eclamptic seizure here. So mom has just given birth to the twins. The birth went well. There are people dealing with babies, and we suddenly notice that Crystal starts making funny noises and starts kind of collapsing and starts convulsing. So I'm going to ask for help immediately to get her. We were already on the floor. We're going to move things out of the way and get her first onto her back. So you could roll onto your back. And this is where she'll have her seizure, and make sure that there's nothing around. At that point, I'm making note of the time, and I'm instructing Mary to go call 911. So I'm going to gently put a pillow under her head as she's having the seizure, and not be too close, honestly, and make sure nothing is near her so that she can have her seizure. We have oxygen close by. We're going to set that up, and have it ready to put it on her when the seizure is finished. Okay, so the seizure has just ended. EMS is on its way. We've made note of the time when it started and when it finished. And we are going to roll Crystal to her left side so that any fluids and drainage can come out of her mouth, and hopefully she doesn't aspirate. We are going to take the oxygen and apply that to her, and just kind of wait for EMS here. We're going to take her pulse, and we could listen to her lungs and make sure that we don't hear any aspiration. We are not able to carry meds here, so I can't give her mag sulfate. Diazepam rectally would help too, but can't do that. Well, that would be to stop the seizure. What else? We could start an IV and give fluids before, or draw labs. If we think that this was due to blood pressure, we could take her blood pressure, do a full set of vitals while she's here. Most likely, or not most likely, Crystal will be post-ictal afterwards and be confused, so constant reassurance and letting her know that she's okay, and kind of giving her guidance as to where she is, and what just happened, and that we're getting her help and that she's okay. And telling her to go to sleep helps. It will rest her brain and not work so hard. And I think that's it. Babies are fine, and mom is finished with the seizure, and help is on its way.